Welcome back to West Texas View.
We have barely scratched the surface about depression and hyperactivity, but now we need to talk about the treatment of these. And I know that you were talking about the seesaw a while ago about the medicine for people that have ADD and those, but talk about treatment for both depression and hyperactivity.
Well, fortunately, for hyperactivity, the treatment guidelines, we have guidelines for treatment, we have guidelines for everything now. Fortunately, the guidelines are very clear-cut in ADHD. Now, the treatment is usually medications. Without medications, behavior interventions don't stick very well.
So it doesn't do any good to say, I'm going to spank you, or you're going to have 2 weeks of grounding.
Doesn't work. And parents will vouch for that. Parents who have struggled with kids having ADHD will vouch for that. In fact, spanking makes it more worse. The child gets more angry.
Because we're talking about a chemical imbalance, not a...
Right. I mean, that's the way, I would say part of it is chemical imbalance and partly because how they are wired. Doesn't mean that we are all wired differently. I mean, your color of eyes is very different from my color of eyes, and so what. So we are born with it. And when nature makes some changes here and there, and this is just one way these kids are born, and fortunately we have found a treatment that works very well. Most kids, I mean, the treatment in the last 10-15 years, we made significant advances in number of medications available to treat ADHD. Compared to last 20 years ago, we had very limited number of medications, but last 15 years, there have been significant changes in number of medications we have, the formulations of medications we have, and if used properly, underline if used properly, they are very significantly helpful. They change lives. Now, I'm not saying counseling or behavior intervention is not effective. I think it's very effective, but only in combination with medications, particularly for ADHD. Now, for depression, I would say, yes, for mild to moderate depression, depression can be very adequately treated by just counseling. But has to be a very comprehensive way of
targeted counseling.
Targeted counseling. That's a very nice way to put it. Targeted counseling is only in severe depression or in depression not responding well to just counseling. Medication can be an added benefit. Now, coming from someone who pushes medication or makes a living out of medication, saying that counseling is equally, if not, is more, sometimes more important.
And limited medicine.
And limited medicine is more important. That must be something to think about. So counseling is extremely important. Best results.
Which is one of the reasons why we want to add the psychologist when we get back together.
Absolutely. Absolutely. And the best results are probably achieved when we combine counseling with medication. The fastest and the best results are available to that point. In fact, counseling has some edges over medication because in counseling you learn ways to deal with the situation, you learn with the interpersonal skills you develop, how to handle the situation, how to deal with your own thinking. The effects, the benefits of counseling are much long lasting compared to medications once you stop it. So your chances of remaining free of depression is much better if you have a good counseling. Now, depression, again, there are a number of medications available for depression. In the field of depression also, in the last 15-20 years, we have made significant improvements in counseling, in medication. But I want to touch upon one cutting-edge treatment of depression that has been approved in 2008 by the US FDA, Federal Drug Agency for long, that is called transcranial magnetic stimulation, or TMS for short. We are fortunate that there are only to have one of those instruments available in Midland Memorial Hospital, and that works together with Texas Tech to treat patients with depression. It's only one of the 2 centers in the whole of West Texas that has this one, so really fortunate enough to have this instrument available to us. So basically what it entails is it's a non-medication treatment for depression. So
now let's say that again. It's a non-medication treatment.
Yeah. So it treats depression without using medications. That's what the major impetus is for. Basically, it involves very insignificant amount of pain, some discomfort, no loss of consciousness. There's no electricity involved, no current involved, no convulsions or seizures involved. It involves 30 to 40 minutes of treatment, after which the patient can do whatever the activity
drive or anything.
Absolutely, everything they can do. And it involves a use of a very high power magnet that's placed on certain areas of your skull, of your brain, that is known to be responsible for causing depression.
So is it like, in a simple layman's term, is it like putting magnets on your head to pull things into the right place?
Well, basically, when you put a very strong magnet, the magnet has a magnetic field, as we call it. Right. The magnetic field, when influenced on the brain cells, it causes some changes in the brain cells, some chemical change in the brain cells. That's known to be effective in treating depression. That is shown to be effective in treating depression.
So this is really, really cutting edge.
This is absolutely cutting edge technology there that we have available in West Texas. I do want to mention that the other one which is not available in Permian Basin is electroconvulsive therapy, or ECT. It's more effective, probably more effective than TMS, but because of the social stigma and some of the problems that is involved with electroconvulsive therapy.
Is that like electric shocks?
Electric shock therapy in popular terms. Electric shock therapy actually is one of the safest interventions that you can do to treat depression. It is so safe that it's indicated to treat depression in pregnant mothers.
So then why did it fall out of favor?
That's a $1 million question. Partly because of, it's mostly because of the public outcry, misinformation.
Because they thought it was inhumane.
Misinformation, misrepresentation by the Hollywood, mainstream Hollywood movies, and because and the earlier stages, it was it appeared that it looks very barbaric, but it is not. If we have a video of it, I can show you that. But we have a video of TMS available that'll show you briefly how.
But that's going to come at the end of our next program. So, or maybe at the beginning of this program. We're going to take a break right now, and we'll be right back.
Stay tuned. West Texas View will be right back.